Okay, so I'm going to start by saying welcome and good afternoon from Berlin. My name is Johanna Hanefeld. I am the director of the Center for International Health Protection at the Robert Koch Institute, Germany's National Public Health Institute. It's my great pleasure this afternoon to moderate a session by the Global Health Hub Germany and the Federal Ministry of Health in Germany on a pact for pandemic readiness, discussing how we can better protect health globally through better surveillance and response. We've learned, I think, painfully over the last 2.5 years that pandemic preparedness is something that's vitally needed and urgently required. So within its G7 presidency, Germany has very much addressed this challenge and initiated a pact for pandemic readiness to advance discussions on how we can improve pandemic readiness, how we can improve our preparedness, both through a focus on surveillance and through strengthening a health emergency workforce. This afternoon, it's my great pleasure to welcome a group of panelists working on this, working across international and national policy on strengthening these areas. We're going to learn about the Pact for Pandemic Readiness, and there'll be a chance to ask questions, to have your questions from the audience. We've got about an hour and a half before I'll introduce my participants. We'll have a set of questions. We'll have 3 rounds of questions, and there'll be a chance for you to ask questions as well from the audience. If you do have questions, please type them in the chat as we go along. If you're not speaking, please mute yourself so we don't have disturbance in the background. Again, as mentioned, I've got 4 esteemed panelists helping me to discuss and illuminate the Pact for Pandemic Readiness. I'm going to start with Karoline Schollmeyer, who's joining us from the Ministry of Food and Agriculture, the Division for Animal Health. She's a trained vet. She's done work both in the West Balkans, but also more recently in North Africa to strengthen animal health systems and prevent zoonosis events. So I'm delighted that she's joining us. Good afternoon, Karoline. I'm also very happy to be able to welcome Dr. Oliver Morgan. He's the Director of Pandemic and Epidemic Intelligence Systems at the WHO. And crucially, he's located in the WHO Berlin hub. Good afternoon, Oliver. Great to welcome you. And then it's a particular delight to welcome my former colleague at the RKI, but current colleague in all things scientific, Professor Fabian Leendertz. Professor Leendertz is the founding director of the Helmholtz Institute for One Health in Greifswald. He's done some groundbreaking work on One Health, and we'll be discussing how to integrate a One Health approach into surveillance this afternoon. Good afternoon, Fabian. And last but not least, it's my great pleasure to introduce Dr. Christophe Bayer from the Ministry of Health. Dr. Bayer is the head of the Division for Health Security and International Crisis Management in the ministry. He's a trained medical doctor and a lawyer by background. He's also a former RKI staff member, I'm delighted to say, but he's also worked at the WHO. And crucially, he's one of the key people within the ministry leading the Pact. So again, delighted to have you with us. Okay, and to begin this afternoon's proceedings, I think, as mentioned, we have a Pact for Pandemic Readiness. So Dr. Bayer, what's in the Pact? What is it about? Please, over to you.
Thank you very much. So first of all, thanks to the GIZ for organizing this event. Thanks for the moderation to you. And as well, thanks for everyone joining us today here online. So welcome. So let me briefly take you on board with regard to the Pact for Pandemic Readiness as part of the G7, which is headed by Germany, the G7 this year. Yeah, thank you for already putting on the presentation. So just to remind you, what are the key pillars currently of our G7 health track? So number one is pandemic preparedness and response. Pact for Pandemic Readiness is one of the key elements, but apart from pandemic readiness, the core pandemic readiness, we are fighting on antimicrobial resistance is one of the tasks, and then climate resilient and sustainable and climate neutral health systems we are looking on as well. So then directly jumping into this G7 Pact for Pandemic Readiness, slide 2, please. We have two major issues which we describe as collaborative surveillance. And then the second pillar is predictable rapid response. So just have a brief look on the third slide with a more detailed example. Third slide, please. Yes. So what is included here is strengthen integrated, interoperable, and interdisciplinary surveillance, of course, following a One Health approach. So the G7 aim to strengthen surveillance systems and surveillance networks. Then it's the support which is further needed for enhancing multisectoral genomic sequencing networks and capabilities, of course, and then make use of centers of excellence, further network these centers of excellence. There are many centers which might not be named as centers of excellence, but which do in the global south and in the global north brilliant work. And as a G7, we want to foster a network for pandemic readiness, bringing these different centers closer together. Then at the heart, as well as the heart for our minister, is the issue of training. We want to invest more into training, capacity building, and as well into networking of alumni who went through training programs. This as well brings us to the next point, which is the focus on well-trained readiness groups. So what do we understand under readiness groups? It's well-trained professionals, might be FETPs, but might be a field epidemiology, which are field epidemiologists, but might be as well other public health trained officials, which help to early detect and as well then to rapidly respond to outbreaks, including by being able to set up respective public health measures. Then, of course, we're looking to WHO. We need WHO, and all of us as a G7 collaboratively, we hope, or we will as well foster WHO own expertise on and own expert response capacities. This might include as well the GOAR network, but as well the EMTs, which are quite important. EMTs, emergency medical teams. GOAN is a global outbreak alert and response network. And then there's as well an issue which we discovered on the standardization of common protocols to make response missions, but as well deployments of search stuff more predictable and standardized. As time is short, I stop here for the moment and happy to discuss further.
Yeah, thank you so much. And I imagine also, please, again, to the audience, if there are specific questions already, do start typing in the chat. I will come to you. But Christoph Bayer, you mentioned the key role of the WHO. So let me turn to Oliver. Oliver, I already mentioned you are from the WHO hub in Berlin. The hub aims to drive innovation around the use of data, around surveillance, around analytical tools and predictable models. So leading intersectoral expertise, linking communities of practice. A lot of the words that, or a lot of the concepts that were just presented by Christoph Bayer. Tell us, so what is the focus of the hub in terms of bridging some of the gaps that were outlined here? And how can the hub make sure that information is shared, that we do have that type of collaborative surveillance? Over to you.
Great. Thank you very much, Johanna. And it's a pleasure to be here with you this afternoon and participate in the discussion. And the WHO Pandemic Hub located in Berlin is really an initiative of WHO with the support of the German government and other partners that really is focusing on filling or addressing some gaps that we've been quite aware of over the last few years, and which were especially evidenced during the pandemic. And one of the big challenges is that there are already so many events that happen every day around the world that when you're in the response space, there's never a chance to think about how to fix the big picture or big systems problems that we have. So just as an illustration, at WHO at the global level, every month we detect 4,500 signals of events that we're worried about as having epidemic or pandemic potential. And we conduct about 300 investigations around the world. And we don't aim to investigate every outbreak. There are outbreaks which are investigated entirely by national authorities. But as WHO, we participate in the investigations of events that we think are particularly concerning, or where there's a capacity gap which we can support with. So that gives you a sense of the scale, and that the amount of signals and the amount of investigations has been steadily increasing over the years, partly because of the increased capacity that we have as a global community to detect and respond to these events, but also because there's the likelihood that many of these events are indeed occurring more frequently. There are several large systems or systemic issues that we face very frequently. Almost every single event that we respond to, and as I just mentioned, we respond to a lot of events every year. And those types of issues are the ones that the hub is trying to address. The first is really around how public health data in particular, and data that support public health decision making, are currently structured and available. At the moment, it's very, very difficult, even in very well resourced public health systems, to rapidly collect information and analyze it and understand what's happening. This is because systems have grown organically over many years. They may not talk to each other or interoperate very well. And then especially once we start looking at multi-country events, it becomes much more difficult when different countries with different public health systems need to share information. There are many issues around the sharing of information, and that's not a single issue challenge that we face either. There are technical problems, but there are also policy issues. There are privacy issues as well. And there are also sometimes there are particular influences of different perspectives of governments and about national security that sometimes get factored into whether information or how information is shared. So it's a complicated landscape. So this is one area that the WHO Hub is working on, both to address some of the technology shortfalls around public health data and how that can be better constructed around the world, and also some of the policies that will help improve some of the sharing. A second area that the hub is focusing on is around the analytics space, as you mentioned. So even where we do have good information and good data, we often don't have the capacity to fully utilize that. As you mentioned, this is really one of the issues that runs through the G7 Pact, which is around the human resource capacity that's needed, especially when it comes to analytics for infectious disease events and infectious disease modeling. We see a substantial asymmetry at the global level, whereby the capacity is concentrated in a few parts of the world or in a few countries, and most countries don't have that capacity. So that's something that we need to address, and that's one of the areas for the hub. The third and final area is to address probably the biggest challenge of all, which is, even when you have good data and you have good analytics, how do you turn those into good decisions? And that's a very complicated process, part science, part art, large part politics. And it's something that's there isn't currently too much structure behind, or at least a structured approach to improving that decision-making process. So it's really a new area. I think that we've recognized has been a challenge for a long time, but it's a new area for our engagements to find ways to improve that decision-making process. And there are lots of ideas that we can consider, both within official decision-making structures of governments and improving the processes by which decisions are taken within government. But there's also opportunities to improve decision making with other sectors, such as the private sector or non-government sector, as well as with communities directly, who ultimately are also stakeholders here, making decisions for their own health and their family's health. So a very broad agenda that we have, but a very exciting one too. Thank you very much.
Yeah, thank you, Oliver. I can see you have your work cut out. And just before I let you go, so thank you for outlining very clearly these three areas. But as you can see on the panel, we do include, and so does the Pact, focus also on the One Health aspect. So I just wondered if I could push you a little bit more on that area and ask, for example, in terms of the data available, how the data is available, in terms of the analytic gaps, in terms of the data to policy and the decision-making element, would you be able to just briefly reflect how do you see that, particularly in a One Health space? How do you view a One Health approach in that? Could you just briefly comment on that aspect?
Yeah, I think all of the things I commented on that apply to the human health sector are probably amplified in terms of the challenge in the One Health space, because we're now really working across many different sectors with many different areas of interest, both in terms of food security and also agricultural production and so on. So it is quite complicated indeed. One of the big challenges that we have is that there isn't a very practiced experience of sharing information across the One Health space at the operational level. It does happen. I've had many interesting experiences responding to essentially zoonotic events where we've had good cooperation at the ground, but it's not systematic. And we often have a bit of a siloed approach depending on whether we're coming from an agriculture perspective or an animal health perspective or an environmental perspective and so on. In effect, we also speak different languages professionally, so that can make it quite challenging. In the decision-making space, my personal observation, certainly when responding to zoonotic events, is that we often have, again, a compartmentalization problem whereby you're either an animal health person who does a little bit of human health or a human health person who does a little bit of animal health. And so we often don't really have the capacity, that true One Health capacity of a professional group that's truly looking across those two sectors without additional responsibilities, which are predominantly either animal health or human health. So I think there's actually a subtle workforce issue in here. And if we want to really do One Health, we probably need people who do One Health, and then feed that into a decision-making process. In the government sector, it's challenging because the decisions might need to be taken both by the Ministry of Agriculture as well as the Ministry of Health. Very different decisions, but for exactly the same event. So simulations and practicing responses could be or is really a very effective way to building those day-to-day operational relationships.
Thank you very much, Oliver. And you've set up very nicely now what I'm going to ask Karoline Schollmeyer, who I'm going to ask a little bit about those working relationships in practice and what you see as some of the challenges from your perspective, but also from your perspective. So obviously, we know the zoonotic origin of many many pathogen threats to humans. For you, from your perspective, where do you see some of the hotspots you're concerned about, and how do you think policy making can answer that, especially bearing in mind some of the challenges that Oliver has just highlighted? So maybe three questions in there. One is, what are the types of challenges you have encountered? Where do you think we need to overcome the most? And where are those hotspots? Karoline, over to you.
Thank you very much, and for me it's also a pleasure to be here. And yes, I am from the animal health side, an animal health person. And well, yes, Not only newly identified infectious diseases have a zoonotic origin, especially considering that we probably do not know 98% of the pathogens with zoonotic potential. Managing already known infectious disease with zoonotic potential is anyway a major challenge for the veterinary service in the federal states, as the federal states, at least in Germany, are responsible for the implementation of EU and national legislation. Nevertheless, the known pathogens still have enough potential to be a threat to animal and humans. For example, in autumn 2020, the introduction of the high pathogen avian influenza viruses H5N8 and H5N5 subsequently triggered the largest AI epidemic ever recorded in Germany and had a severe impact on the wild bird population. Even indistinctly zoonotic properties are known for this virus. Highly pathogenic viruses must always be expected to gain virulence when leaping into other host species. Thus, fatal infection in seals, martens, and otters are increasingly being described. In order to control an outbreak of a disease with zoonotic potential in livestock and wildlife, cross-sectoral cooperation is of utmost importance, as already said by Oliver. In addition to the control measures of the veterinary services, the Federal Research Institute for Animal Health, the Friedrich Loeffler Institute, is highly involved in disease control, for example, in the context of its task as a national reference laboratory, or by preparing risk assessments for Germany in total, and as well for on the spot for the federal states or in the federal states, and supporting the veterinary services in epidemiological investigation and so on. The data collected in an event of an outbreak is available to the EU and the VOA, former OIE, and all interested states through the VAHES database at WOHA. However, the data could and should be used much more by other sectors, for example, to raise awareness among human health professionals and to inform at an early stage.
Thank you very much, and thank you for outlining how some of that works in practice, Karoline. So now I'm going to turn, last but not least, so Oliver Morgan said, okay, to do One Health, we need One Health people. So I think we've got a One Health person here. Fabian Leendertz, you are founding director, you're professor, founding director of an institute of One Health. In your research, thinking around some of the themes we heard from the Pact, taking surveillance as a first area, but also the health workforce issue. What do you think, how can we focus surveillance into a One Health spectrum, for example? From your perspective, how would you work on some of those issues? And what do you envisage as some of the challenges?
Yeah, thanks a lot, and thanks for the nice invitation here. As you said, we are a new institute, and we have the unique opportunity to not just add a little piece of human health to animal health or vice versa, or perhaps even not ignore the environment. We really want to set One Health as a foundation of this new institute. And so we try to have this truly integrated approach through something which we call a One Health surveillance. And this One Health surveillance we can't do all over the world. Obviously, that would be perfect and super cheap if we would be able to do that with the money we have. No, we will take a deep dive in specific regions, 2 in sub-Saharan Africa and 1 here in Germany, actually, where we are then envisioning 3 kinds of activities. One is like a One Health cohort. So we will have highly exposed people like hunters and farmers who will create that cohort, and they will be closely monitored. But in addition, we monitor the animals around, including the mammal biodiversity and the environment, including the climate. So we really try to have all the components you need for a true One Health analysis in a deep dive approach in those specific areas. Then we will also, the question is with the surveillance, are you focusing on one specific pathogen, or can you be unfocused? Because I think this is what we need. We need to look at the real issues. So we take the broad view and look what makes people and humans, people and animals sick. what is the directionality of transmission, what is the influence of the environment. So we will not just focus, for example, on influenza. Influenza will be part of that, but we will keep the broad view and with a special attention to the sort of unusual, unknown, or perhaps neglected knowns. Like when we think about monkeypox, we know it's been circulating since many years in Congo Basin and in West Africa probably as well. You know, we have to understand better the epidemiology of those known things, because understanding that will help us to protect the rest of the world. And so this is then linking closely to partnerships internationally, and I think we're coming to that a little bit later as well. But obviously, we need that surveillance on site as close to the reality and to the spot where things are happening as possible. And then this is leading to technical aspects like analyzing the unknown is not impossible anymore these days, and you can do it even in the most remote rainforests of the world if you need to do so. And this is just a little bit the concrete actions we have planned. They're building on existing activities, but with this new institute, we have the opportunity to really put some continuity in there. We have to look at the dynamic system. We cannot do just a snapshot and then think we understood how things are connected. So this is a little bit what we will be aiming at here.
Okay, wonderful. So a real example, a deep dive, an example of how to put some of those things into practice on a practical level. We've got some questions in the chat now, which I would like to put to colleagues. Can I just say, I have a slight echo on the line. So if you're not speaking, could you make sure your microphone is muted? Thank you. So there are some questions on the Pact. Christoph Bayer, to you, as part of the Pact for Pandemic Readiness, are the G7 partners considering a clear investment case for the planned readiness teams to mobilize political support for long-term financing from domestic budgets, from donors, and/or innovative mechanisms, such as assessed contributions from members, or the new pandemic financing facility currently proposed by the G20? That question comes from Johann Voss. Christoph Bayer?
Yeah, thank you very much. I can give you two answers. First of all, it's a G7, and the G7, I mean, we can't speak for other countries and only for the G7 countries. So this needs to be, of course, for sure, but definitely we want to lead by example. The FIF, this financing intermediate fund was mentioned, and I think there's already an agreement that the FIF, when it's going to come then, that it will focus, as the name is saying, the longer name of the FIF is focusing on pandemic preparedness and response. And the issue of capacity building, which as well will cover then, let's say, sort of readiness teams, or however you wanted to name them, public health emergency workforce or public health experts working on surveillance and response. Hopefully these will be fostered by funds of the FIF as well. Then asking more directly to the G7, what are we doing? So within the framework of the Pact for Pandemic Readiness, health ministers made commitments written down in the G7 Health Ministers Declaration. And there we agreed as well to work until 2027 toward our collective goal to assist at least 100 countries implementing the IHR core capacities. So one of the concrete commitments of the G7 is the commitment to strengthen support for low and middle income countries in implementing the core capacities required in the international health regulation. And as we all know, that at the core of these core capacities, to say so, capacity building, investment in health workforces is one of the key elements. So that's an answer, and hopefully it will be understood as a clear yes, there will be investment.
Wonderful. And there's another question from the floor from Leopold Reif, who is asking, how do you see the role of improving health literacy for pandemic readiness, and what actions are planned here by which stakeholders and institutions? Very interesting question. Health literacy for pandemic readiness. I'm going to actually ask Oliver Morgan from the WHO if he wants to comment on that. Oliver.
Yeah, great. It's a fantastic question, actually. I think we've had some acceleration actually in health literacy during the pandemic. There are many topics that have been discussed quite widely around the kitchen table that I would never in my professional life have imagined that people talking about lateral flow assays and concepts such as the sensitivity and specificity of certain tests. So from a public health perspective, actually, and the health literacy perspective, we actually, I think have made some progress here. I think where the opportunity and the risks lie is whether those of us who are working in pandemic readiness embrace the breadth of our communities. And I've hinted at that already. My previous answer was that we really need to think beyond our traditional public health departments, which are largely government funded. We need to think beyond our academic institutions that we know and love. We really need to think about how we engage in all parts of our societies, including civil society and at the local level. And now there's, I think, quite a large amount of health literacy that has been developed during the pandemic. It's a really important opportunity. And now we challenge ourselves, are we really truly engaging and asking our communities what they think and what they consider to be important for preparedness and readiness? I think we probably not. So there are some opportunities here. I think there's also probably some indication that, when you look at different countries as well, there is different health literacy for public health in different countries, and different familiarity with types of preventative approaches. And a very kind of obvious example is the very common use of masks in Southeast Asia before the pandemic, which led to much easier adoption of certain measures, such as almost universal mask wearing, really, in Southeast Asia during the pandemic. That's just one example, but there are many other examples about the concept of participating actively in preparedness and response activities on the ground. And so I think there's enough, certainly anecdotal evidence, and maybe somebody in this forum, one of the participants might know of some published evidence to show that where there's higher health literacy, there's greater responsiveness of communities when there is a problem.
Great, and I encourage the participants to please do take Oliver's challenge and type in the chat if you have that. I'm just gonna ask Karoline and Fabian as well. So Karoline Schollmeyer, in your experience, is there greater health literacy? Do you think since the pandemic has come, are people more aware that your work is integral to the health security of the human population, for example? Is that an experience that you're sharing? Or do you think much needs to be done around the sensitization between the connection of animal and human health still?
I think the latter one, has to be done to connect these both subjects together. And even though if there is an outbreak, for example, in animal diseases, it would be also helpful, for example, to make a better connection to the human health sector, to have some human doctors also accompanying the veterinarians on the field, on the farms, on the premises, just to have a look. Is it a serious situation which should be reflected also in the public health system? So I think, yes, indeed, it is a challenge, and we really have to work on this.
And Fabian, Leendertz, I'm going to ask you, because I know you do a lot of work in Africa. You've done a lot of work around One Health approach and so on. In terms of the health literacy, the awareness there, have you seen a shift during the pandemic? What would you say? Can you say there's a difference, high income, low income country, pre-pandemic, during pandemic?
We didn't study that systematically, I have to admit. But by giving this institute the name One Health, we did a natural experiment, basically. And I mean, come on, Nigeria has a One Health strategy for the country. Cote d'Ivoire, Ivory Coast, has a One Health commission between the ministries. I'm not aware of a One Health strategy yet in Germany. So I rather see the challenge here that when I go to the MD here because I have a back pain, he says, oh, you are the new director of this institute. By the way, what is One Health? That's the MD who studied somewhere here in Germany and does not know what One Health is. So there is still a lot to be done, and I think we need more concrete. It's a nice concept, this One Health, but we need more and active, good examples of what is One Health and how does it work to make sure we are not failing with this concept. So we need those examples.
And Christophe, I'm just gonna ask you whether you want to comment as well. Health literacy for pandemic readiness. What is the thinking of the G7 around that? What's the thinking of Germany as part of the presidency of the G7?
Yeah, just wanted to give this example. We were doing as well an interactive session and as well focusing on a hypothetical scenario of a new disease. And we were discussing as well the aspect of communication. And I think a proper communication, trusted communication is as well key to health literacy. And there are so many aspects that we could discuss, I think, the entire afternoon of health literacy and health communication and this. And we can look at the current situation right now. It is quite hard really to come along with the different advices we are currently getting, for example, on the fourth vaccination or on the second booster, which is there. So I think health literacy is definitely needed in order to understand that in order to make some decisions, there's no clear yes and no, that there is more that there's not the final science base already there, and it's evolving in this regard. And of course, the G7, to say so, discussed a lot about this. But I think the agreement was that there needs to be as well domestic investment in a clear communication strategy.
Thank you. And that also speaks to the important work the Hub has to do on its third task, really, around how the evidence leads to decision making and how we can provide data around to then ensure pandemic readiness, but also response. So thinking then a little bit around the kinds of capacities we will need to put this Pact for Pandemic Readiness into action. Achieving global health protection, Christoph Bayer, depends on global pandemic preparedness. We know that many countries are lagging behind in terms of public health surveillance, but also in terms of the outbreak response capacity, having potentially higher risks, having potentially higher vulnerability. But of course, we're also part of a global ecosystem, so belonging together. What does the German government, in particular the Federal Ministry of Health, do to support preventive approaches, to build capacity of partners as part of this Pact for Pandemic Readiness?
Yeah, thank you very much. I think the Pact is as well summarizing activities and wants to foster as well further activities in the field of collaborative surveillance and rapid response. And therefore, I wanted to give you an example of what we are already doing, but something which was already boosted or will be boosted by this Pact for Pandemic Readiness. For example, I think just in general, to be fair, is that Germany also since quite a while is providing a lot of development aid and is providing as well a lot of practical work in the different fields. And mainly, to be fair, we have to mention that this is a responsibility of our fellow ministry, the Ministry for Economic Cooperation and Development, with whom, of course, we work very closely. Just let me to mention as one example, the program we as the Ministry of Health started in 2016, which is a global health protection program. Our idea was we wanted to bring in very specialized public health institutes, which is in our responsibility and within our subordinated institutions, of course, such as the Robert Koch Institute. And our idea was to strengthen these capacities, these international capacities, and make them use globally, to bring them in to take over more responsibility in our global work. Therefore, since then, a number of German institutions operating in the field of health have been supporting partners across the world in preventing and fighting disease outbreaks and, of course, creating partnerships. I wanted to highlight the twinning approach, which we use quite often to build capacities and capabilities. You know it quite well, Johanna. But at the same time, for us, it's a project approach, but we are focusing as well on long-term institutional partnership for mutual benefit. It's for the benefit of the partner, but of course for the benefit of ourselves as well, gaining experience, sharing experience, and developing together networks and to find solutions for specific problems. And then coming back to the Pact for Pandemic Readiness and the G7 that I said, it boosted as well what we are doing. We are quite happy that we could have been able to convince lawmakers and parliamentarians of the quality of our work we have done, and therefore we were granted further funding, therefore that we can enter the next phase of our Global Health Protection Program, which will start then in 2023. And the thematic focus will be on capacity building and activities related to collaborative surveillance and predictable response. Stop here for the moment, yes.
Great. And can I ask Karoline Schollmeyer a similar question in a way? How does the Federal Ministry for Food and Agriculture advocate for One Health approach at international level? How do you build or improve collaborative surveillance or intelligence measures and the response at the animal-human interface?
Yeah, thank you very much. I would just like to start with to take up the words from Fabian. He said there is missing this human-animal interface is somehow missing, and I just wanted to mention that the FLI, which is an authority within the competence of the ministry, was founded by a medical doctor, Friedrich Löffler, in 1910, and he started to conduct research on foot and mouth disease, and of course, this was one of the world's oldest virus research institute. But anyhow, interestingly, after he went to the Robert Koch Institute in Berlin in order he was appointed as a head for this Institute for Infectious Disease on Public Health. So you could say that the human-animal interface was established more than 110 years ago, and somehow we lost the track, so we have to find it back somehow. But yes, now I'm coming back to what is the ministry doing. For us, of course, the One Health approach is not just the human-animal interface, but as I said, it can be seen as a start. So the ministry, for example, is since 2050, it's supporting the WOHA control program for dog-mediated rabies in Namibia with 650,000 doses of rabies vaccine to help drive their mass dog vaccination campaigns as a core component for an efficient rabies elimination strategy. This project is also used as a model example for implementation of the global goal for 0 by 30 in rabies control. Furthermore, in regard of rabies, FLI has, as a leader of the WHO Collaborating Center for Rabies Surveillance and Research, is engaging in collection and collation of information, research, as well as training and education. Coming back on to the One Health approach on the international level, in 2020, the Institute for International Animal Health, One Health, was founded at the FLI with the following tasks: combat animal diseases and zoonosis where it first occur, prevent the spread. This is one of the main tasks. Research and capacity building in close cooperation with other specialized institutes of the FLI and in the international network, including the quadripartite. Rapid and flexible assistance, also in connection with the BMZ-founded German Epidemic Preparedness Team, the SEEG. Furthermore, the FLI is currently establishing base stations for long-term regional capacity building in Africa and in Vietnam. In Asia, they already started the process. So to sum up, the ministry advocates the One Health approach on the international level through the outstanding scientific competence of the FLI and other authorities within the ministry's authority and their involvement in international boards.
Thank you so much, and really interesting to hear that internationalization that's also happening there, and very much hand in hand, obviously, with the human side. So we've heard around the science, Fabian Leendertz, as somebody working in the academic space, predominantly around science and research. How can that contribute to building some of the capacities, and what do you see with you mentioned around the surveillance, some of the activities that you're going to do, but with your institute, how do you think you will contribute to building those capacities and in a way contributing to pandemic readiness globally?
Yeah, thanks a lot. Just to briefly mention, the Friedrich Löffler Institute is also one of the founding partners of the Helmholtz Institute for One Health here in the region. So there are close connections also to these international activities. But to your question, I think what I mentioned earlier is that we need more good examples of how One Health can work in a true One Health framework. So not necessarily in the anthropocentric framework. It is going in all directions if you take One Health series. So you're doing something good for humans, animal, and environment. And so we have that bottom-up approach where we are really working with the communities on the ground. It's not us telling them where the risks are. We are just the ones, and our African partners, for example, generating the data. And then we're discussing them with the population, with the people exactly at that spot. And then we see if they perceive certain things as a problem. And if they perceive it as a problem, then we together develop mechanisms how to reduce, for example, the risk of spillover of certain pathogens. And I think that know-how can then really have an opportunity for translation locally. And if that works, you can go regional, and then depending on the nature of these findings and on the countermeasures, it can go global. And this is where the link to the global level is very important to us. And we have started some discussion already with the WHO hub Berlin, for example, with the colleagues there and other initiatives around the world, how our data can help others to set up the bigger models and to bring those into the bigger translation. I think these are so then serving for a top-down approach, which we need in addition to the bottom-up approach. And I think this is somewhere where I see the role of research in the whole picture.
Thank you, and I'm going to come to Oliver in a moment and ask him around the capacity building that the hub intends to do. But I'm just wondering, Fabian, because we're talking and we heard the Pact mentions the centers of excellence and the importance of networking. So I just wondered from your experience, what are some of the key ingredients you need if you want to build such a bottom-up approach? How can that be best enabled by, I guess, people like us in the global north who want to create a policy environment, and of course who may have the financial resources to support something like that? What, from your experiences, if you say bottom up, that's the approach you will take, what are some of the key elements that are important to that?
I think the key elements is the really to take all the different sectors of the society and the different disciplines truly on board. And then, yeah, centers of excellence, that always sounds very nice. What do we mean with that? Are we in a center of excellence? I think some of our African partners and even the chief in the village somewhere has excellent know-how, which we should use much better than we used to do. We have to learn to listen again. And then that can create a very, across different levels or regions of the society, a very nice center of excellence as an example, for example. And so I would want to think about these ivory towers or something like that. I would see that truly down to the communities who are really concerned. And so obviously it would be great to have and I think there is growing evidence for political support on these kinds of actions. I'm also a member of the Scientific Advisory Board for One Health of the BMZ, the Ministry of International Collaboration here. So the different ministries are thinking more and more into that direction. And I hope that people also, and I be One Health, and that would not be functional.
Great, and I'm going to come to Christophe in a moment. Also, just to say to the audience again, if you have questions or if you have ideas and and suggestions from your experience where you say that that is how to build that type of preparedness and readiness, including in the global south and through networks, do type that into the chat, do contribute. But Oliver, I'm going to come to you. So you did set out the 3 areas that the hub works on, and obviously capacities need to be built in each of these 3, right? And you need to, obviously you are a center of excellence, being a hub that specializes in something that wants to drive forward best practice. But at the same time, I imagine you guys need to straddle the bridge to this very embeddedness to ensure that you capture that local expertise. So what's your view on that, and what are some of the models that you think you will take for that, or that one can take to operationalize that?
Yeah, this is clearly a challenge in all health systems and all government systems, for sure, in which the need for ever increasing resources is the same across all different parts of government. But certainly for public health surveillance, we find ourselves in a kind of a double constraint in many ways. So we have our existing surveillance systems that are set up and running, which are usually fairly poorly funded and often have, the sustainability of that funding is also not secure. So we need to do some work around making sure that what we have continues and doesn't disappear, and that's a constant challenge. But then at the same time, we see this huge technological revolution happening in all things data, and we see a lot of progress in many sectors, but it's struggling to translate into the public health sector, certainly into the surveillance sector. So there are these kind of 2 constraints at the moment that we need to address. Adding to that, to make it even more complex, is that nobody's got a good estimate about how much surveillance costs. So we tried to do that last year, I think it was, and we included some initial kind of guesstimates in a paper that we published last year. We thought about $1 to $4 per capita per year it might be, enough to fund an adequate public health system, but it was extremely difficult to make a reliable estimate. And there's ongoing work also to try and understand that as well. And part of the challenge is much of surveillance happens kind of leveraging off an existing health system or an existing animal health system, for example. So a lot of the inputs into surveillance are essentially difficult to quantify because they're being paid, doctors and nurses and veterinarians are being paid for clinical work, but they also contribute to surveillance as well. So understanding what the inputs are for surveillance is massively challenging. Another area where we see a change in capacity is that and I've alluded to this in one of my previous answers, was that the actors or the stakeholders in surveillance is also changing. And so we had a really interesting, we run an innovation forum and as the hub where we bring together different groups around the world who are innovating in the surveillance space. And our last meeting, we had a really exciting conversation with groups who basically didn't really exist before the pandemic, and they were largely academic-based organizations that have become major players in global surveillance over the last 3 years. So, we had the Johns Hopkins COVID-19 dashboard team, Our World in Data, and a new entity called Global.Health, and they've become really important players in global health surveillance. And they just simply, kind of came out of the pandemic. So when we think about capacities, we do need to think beyond our government sector. We can't leave the government sector to wither away. It's vitally important that we have a strong government-funded and led surveillance system. But at the same time, we need to create space and encourage other sectors to come into the surveillance domain and feel confident enough to invite them in. And that can be challenging from let's say a traditional government perspective, or from, even from a WHO perspective, where we have a fairly tried and tested kind of government-driven approach to doing surveillance, and inviting other actors into that space, it can be a bit challenging, but it's really important. So I think as capacity goes forwards, when we think about it, it's about doing some of the core work that we need to do in terms of advocating with our governments, so that we have our core public health surveillance funded well, and that includes people and machines and all of the other associated costs. We need to think about new entries into the market, as it were, with different sectors coming in, offering new things. And then we need to think about the technology side and how that can also be leveraged and help us go forwards. So not a very clearly mapped out landscape. Again, another area where we think if we work on this in a more dedicated way, clarifying what that landscape looks like, we can at least motivate some important policy dialogue in this space.
Thank you. And I think we look forward to that convening function of the hub as well. I just wanted to, before moving on, I just wanted to come back to Christoph Bayer and also ask him a little bit the question Karoline Schollmeyer was reflecting on, and that Fabian Leendertz highlighted. From your perspective, what has worked well in bringing different sectors together in government? Maybe either from your own experience of working throughout the pandemic here in Germany, bringing different actors together, or also in the work that you support internationally. I don't know if you want to comment on that.
Of course, I can do. So what does work well? I think a constant networking is the key for collaboration and constant networking, and setting up a working group, formal or informal, before a crisis hits the country. I think that's essential. And there are several occasions where we have done so as well, including, for example, talking about global health here within the joint external evaluations, where we convened a lot of stakeholders from different disciplines and as well from other sectors as well. And this was another layer for our, let's say, networking within the government. And there are as well other formal examples we have here in Germany, which worked quite well as well during the COVID-19 pandemic. For example, that there is already set up and regularly trained interministerial working groups as well on a national level, but as well on federal state level. But of course, I have to admit that interministerial collaboration is quite a challenge. Intersectoral and multisectoral collaboration is quite a challenge, which is sometimes as well based on the fact that in our day, or that in the majority of our day-to-day work, we are all, not to say in our silos, because silos has such a negative impact, this word, but we are all working on our different specific fields and sometimes being in a tunnel. Therefore, I can only invite everybody to use the opportunity of networks, and hopefully being able to do so not only via video conferences in the future more often, but as well during personal meetings, and this while having a side coffee during a meeting. This is quite essential. So institutionalize working groups and interministerial collaboration. This is a key, as well with the personal collaboration and context, which is important to build them before a pandemic hits, before a crisis hits.
Yeah, and maybe even, thank you, maybe even an opportunity now to build on some of that sense of urgency that brought people together, or that has brought people together during this pandemic, and if we can build on that. So I just wanted to talk a little bit more around cooperation and partnerships and the kinds of initiatives that are ongoing to break down those silos. And Karoline, I wonder whether I could come back to you and ask again the Ministry for Food and Agriculture, what existing initiatives are there at the moment at international level that seek to break down some of the silos, and what kind of areas do they deal with? So maybe you could give us some examples. It'd be fascinating to hear. Please, over to you.
Thank you. Yes, I will give you some examples from our side, from the veterinary side. So the animal disease and zoonosis, they are a central cornerstone in the One Health, but also in the policy of the Ministry for Food and Agriculture. As the speakers already said, nevertheless, there is still a lot of work ahead of the ministry involved, and it's not just the Ministry for Health, it's also Ministry of Environment, etc., in the development of a federal One Health strategic action plan. And regarding the aims of the ministry with respect to the international organizations, well, the ministry, for example, is technically responsible for the WOHA and for the FAO within the government. We have a close cooperation, and especially to the WOHA in regard to develop the animal disease control plans and schemes. I think with the OLAP, I don't have to say so much because Professor Bettenleiter, as the president of the FLE, is the co-chair, so he is well presented there. And so the excellent and far-reaching scientific knowledge of the FLI is a valuable drawing for us, for the ministry. From the ministry point of view, the data collection and early warning system in the animal health in Germany are largely harmonized and efficient. They haven't been for such a long period, something like 22 years, started with the BSE crisis, where really everybody saw in the veterinary system that something has to be done to have a better overview over the animals. Where are they located? How many are they? And so on, just to get a better overview, since the animals one day will become food. So that's why it was very important to have a better overview. So this is why within the last 20 years, a lot has happened in this regard. So the data collection by the local veterinary services is stored in a database for official surveillance in the veterinary and food sector. Thus, the database enables an effective and efficient management of monitoring activities. And as I said, it is harmonized, it is the same database in all federal states. The information on disease outbreaks entered into a national animal disease information system called TSN, which is managed by the FLI, by the veterinary services, and can be used, for example, to detect outbreak clusters, which is also important for early detection. The ministry is reporting disease outbreak within 24 hours to the EU via the Animal Disease Information System, the ADIS. And additionally, the ministry is, of course, notifying disease outbreaks and follow-ups within 48 hours to the WOHA. On behalf of the ministry, the FLI is, amongst others, involved in animal influenza organization called OFFLU, which was founded by the WHO and the FAO, and is supported by, it was founded by OIE, by WOA, FIO, and is supported by the WHO, where global data on animal influenza viruses are integrated with a perspective on One Health topics. Then for the Central European Data Hub at the EFSA, for combined epidemiological analysis, the FLI coordinates the flow of surveillance data on avian influenza both in wild birds and poultry generated by the veterinary services. In summary, the ministry and the FLI, as well as other authorities within the ministry's authorities, such as the Federal Institute for Risk Assessment, which is also a very specialized and sophisticated institute, and the veterinary services and their laboratories have a wealth of information at their disposal, but so far no interface has been established with other sectors, such as the health system. So in the sense of One Health approach, merging of human, animal and environmental data should be strived for long term by all authorities involved in Germany. Due to the federal structure, this will be not an easy undertaking, but now it's the right time to take up the challenge.
Okay, thank you very much for that. And I think I am going to add for some people in the audience who may not know. So the OLAP is the One Health high level expert panel, right?
Sorry.
Yeah, so by WHO, FAO, OEE, and UNEP, where Professor Mettenleiter, the head of the Friedrich Loeffler Institute, is present, and I'm also happy to add that from the RKI side, we are very happy to be able, in the frame of the Global Health Protection Program, to be able to operationalize some One Health approaches in projects in countries where we are working, where we're working together. Christophe Bayer, Pact for Pandemic Readiness, we've got the commitment from the G7 countries. What are the next steps to achieve this? What will happen now? Well, how will we go forward to bring this into to implement this and to take the next steps?
Yes, I can briefly talk about this. I already mentioned that when you are looking to the health minister's declaration, you find as well something on the commitment to help countries to implement core capacities required in the international health regulation. And I think this is already a big point that we agreed to work until 2027 toward our collective goal as a G7 to assist at least 100 countries implementing these IHR core capacities. Now, regarding the strategic outline of the Pact for Pandemic Readiness, we will convene with the G7 and decide on a roadmap for implementation and general cooperation. We will do so, or we will start to do so during the second half of 2022, and it will be then for us to come up with more concrete action items and deliverables which we as well can follow up on, and which we can follow up on as the G7. In the end, we will have to be measured against whether we have achieved a real contribution to a stronger global health emergency capacities and a workforce that can rely on good global surveillance systems and a workforce that is trained and can interpret the data coming out of it, out of these surveillance system, and which is ready to take preventive actions and as well hopefully following a One Health approach. So in a nutshell, we will work with more concretizing the Pact for Pandemic Readiness during the second half of 2022 with the G7 partners, and one of the core deliverables is as well our commitment to continue our support and now to aim for 100 countries implementing IHR core capacities until 2027. Here we have the 27. Thank you.
Excellent. Thank you so much. So some very concrete actions to follow. And just before I turn to Oliver Morgan and ask him really some of the concrete steps that the hub plans to take to further build the capacity and maybe also to push you again a little bit further on the network and the centers of excellence and how to network with other parts of the world. Just to reiterate to the audience, if you have questions or if you have comments on in terms of how to take forward pandemic preparedness and to take forward this pact, what other sectors need to be engaged and what other sectors can contribute, do type that into the chat as we go along. But Oliver, I'm going to turn to you and I'm going to ask, so what does the hub plan to do? Obviously, WHO is a key partner of the G7. You were part of the health ministers track. And you set out your very ambitious agenda in which clearly sort of novel surveillance approaches are key. But what are the next steps that you intend to take to really build that capacity? And I just wonder if we can unpack that network around the centers of excellence a little bit. So you have a hub in Berlin, which the word hub already means you're gonna. That's a connection, right? That's a connector in a way for a network. So I wonder whether you could highlight a little bit more. And again, if you want to comment on the One Health approach within that, do. But otherwise, yeah, I hand it over to you.
Great, thanks, Johanna. So we've highlighted a concept which we call collaborative intelligence as one of the core areas of focus for the hub. So we have the surveillance component, we have a collaborative intelligence component. And the reason why we've done that is that we believe that this is an area that needs very deliberate focus and effort. So surveillance is not really about data per se. The data is what connects people together, and the people working in a public health system kind of communicate via data, or more or less, right? So that's a kind of conceptual way of thinking about it. So what we really need to invest in is the networks of people, and then facilitate the exchange between them with data and other types of communication pathways. So, you know, it's a really critical part of surveillance, and we want to make it a bit more explicit that, you know, if you're working in what we call intelligence, which is, you know, there's surveillance and then there's gathering other information that goes around that, epidemiologic information, then that intelligence approach, like other forms of intelligence, is built upon relationships. And you know, I set up and ran WHO's current global pandemic or global epidemic intelligence system, and we invested a lot of time and continue to invest a lot of time in those personal networks, because certainly when there's a crisis, you need to be able to have trust and confidence to share. And again, another concept that we talk about is the trust architecture. The world needs a stronger trust architecture so that we can share information, certainly at the technical level, as rapidly as possible. And that trust is built in advance of something bad happening. And it's a constant activity. It's not something you can do once off. It's an ongoing process. So that does mean you've got to actually spend time doing it. You've got to factor that into your job description and apportion a significant amount of time to building those relationships, whether that's between human health surveillance communities or across different sectors with animal health and environmental health surveillance communities. You know, that's a very deliberate effort. And there are things you can do to structure that, and some of them are fairly straightforward, such as having regular exchanges, in-person meetings. You know, Christophe also alluded to the importance of that. But you know, there are also other ways that we can think how to do that. One of those is that there are actually many self-forming groups. You know, not everything needs to be governed and managed from a top-down approach. Right, so there within academic communities, there are many self-forming groups, and with a bit of support, those self-forming groups can be self-sustaining and actually very, very important. And we've seen that a very good example actually of that is around the infectious disease modeling world, which has been very, very networked throughout COVID-19 response. With very light touch support from WHO, but a very active engagement by that community to exchange and support each other. Just one example. I mean, there are many, many examples through COVID-19 of these self-supporting professional groups. So you know, thinking a little bit outside the box when it comes to collaboration, and say, you know, it's more than just going to the occasional conference and or having a drink with your friends occasionally. You know, it's actually something that we can think about strategically. And build those networks. One particularly important area is, and actually something we are talking about with the HERA, which is the Health Emergency Response Authority of the European Commission, when they visited us yesterday, is that, you know, they're likely to be areas, whether they're geographic areas or professional areas, which are kind of unconnected. Which we don't have very much insights into what's happening. And if we can think about these things in a bit more of a strategic way, we can build approaches to connect those different, either, you know, professional communities or geographic parts of the world that are not connected. But unless you're engaging with that strategically, you're going to miss it. And different countries and different cultures have different ways of networking somewhat. So, you know, there's a little bit of specificity to that and how that's done. And at least for WHO and the WHO hub, we do have an enormous network. We have countries and offices in 147 countries. We have 6 regional offices. We do have a global outlook. And for global public health surveillance. That's obviously necessary. You can't have big parts of the world that are not included in your surveillance approach. So we have to think every country, every community around the world all of the time, which is enormously daunting. But once you kind of break it down, and certainly, you know, our regional structure can be helpful in that regards, then it is achievable. Where the journey will take us, I guess I'll come back and happy to provide an update, you know, as we go forwards. But again, this is another example, I think, where the hub is trying to approach things not in a radically different way, but take the things that we already know are a bit of a challenge and try and focus our efforts on those things.
Great. And we've got a question in the chat that I'm going to take and put to several of you. So there's a question from Annalena Hasselder, which is asking about whether how the Pact for Pandemic Readiness is going to link to climate change preparedness. And if so, if this intends to do it nationally or internationally. And there's a comment here around the One Health concept, I guess, still being a little bit of an abstract concept with concrete steps for alignment needed. We've heard a little bit of concrete steps, but I just wanted to put the question around the climate emergency and climate preparedness to Christoph Bayer initially.
Yeah, thank you very much. As mentioned in the very beginning, we had 3 different areas where we were focusing our G7 presidency or the health track of the presidency this year. And we have pandemic preparedness, we have antimicrobial resistance, and as well climate change, health and climate change issues. So it's 2 different tracks, but nevertheless, following an all hazard approach, pandemic preparedness requires as well a generic preparedness for all kinds of disasters, to have a health system which is able to address as well all kinds of disasters. And we are quite often, or even more and more often, unfortunately, struck by sudden onset disasters due to extreme weather events. Therefore, when we want to achieve pandemic preparedness, we have to work as well on a number of generic crisis functions, and this will be as well useful to address the extreme weather events, for example, which might become more often. Therefore, the Pact for Pandemic Readiness is not directly addressing climate change, but it might have an indirect impact on results of climate change.
Thank you. And I'm going to put the same question, obviously a different perspective, to Fabian Leendertz, asking him, so how do you connect the 2 in your research?
I mean, the aspect of climate change is extremely important when you want to understand the emergence of certain diseases. I just want to remind that, for example, the distribution of various arthropods is changing with the changing habitat connected to the changing climate. Or when we think about, let's talk about monkeypox emergence, right? I mean, some rodent reservoirs out there are heavily influenced by the local and global climate change we see, and that changes the quality and quantity of contact between animals and humans. And so climate is something we always have to have in our equation. So I think it's taken up serious, and I'm very glad that in the OLAP, which was mentioned before, also the UNEP, the United Nations Environmental Program, is present now, because that was sort of a plus something, and now it's really in the core of that overarching initiative. So I think climate is taken serious, luckily enough.
Oliver, and I'm going to put the same question to you very briefly, sort of to what extent do you connect climate change and climate preparedness activities when you think about pandemics and signals in the work that you're doing in the analytics?
Well, not enough. I'll be straightforward and say that that we need to do much more of that. And actually, I think there's a lot we can learn from the environment side in terms of approaches and methods as well. There was a really fascinating kind of mini conference around using data and creating federated data structures for environmental data. Because just like for human health data, the understanding what's happening in our environment is driven by good data collection and sharing and good analysis. I mean, it's all the same construct, really. And in some ways, I think they're ahead. In some sense, I think there's certainly more routine sharing of climate data than there is, but there's still many problems in the climate space. I think in the human health side, I think we can fairly straightforwardly kind of connect some of those data. I think the World Meteorological Organization has already done quite a lot in this space, but we don't tend to do it routinely. We often, when we do think about it, we think about it in a reactive way. So that's either, particularly with rainfall, it's either an excess of rainfall or a lack of rainfall over a period of time, leading to change of conditions, which then increase the risk of transmission of infectious diseases. And we can, I think we're fairly good at understanding what some of those drivers are after the fact. Where we're not really that good is predicting when these things are going to happen and then having enough or kind of robust information to intervene, to commit resources to intervene before a problem happens. So we're kind of going around the same circle while there's an outbreak. We say this is the cause of it, or it's kind of partly driven by climatic factors. This is really important that we consider climate, and then we move on to the next event and we kind of go around that same circle. What we haven't done is really get ahead of that issue and say, oh, climate's changing. We anticipate these events to now be occurring or now increasing their risk. And these are the preventive measures we need to put in place and monitor how those preventive measures are hopefully attenuating risk. So there's a big shift from where we are now to get to that point.
Yeah, and obviously the nature of the emergencies is also such that they're so complex that in future in the response activities we will need to consider both aspects at least. I just wonder whether Karoline Schollmeyer, I can also ask you to briefly comment on that connection from the view of your ministry. Obviously, climate change also and climate preparedness hugely important to the work and the focus that you have. Do you want to briefly comment on how you consider these factors together?
Yes, of course. Thank you very much. Yes, climate change is very important. There are different kind of pillars who are interesting. For example, the food. So who should get the food? The people or the animals? So you have to think about what about the water? How do you use the water for production of the plants? So this is always very important. But another aspect of the climate change is also the vector-driven diseases, because we haven't had before West Nile fever. When I studied, these were all kind of really extreme situations you were only thinking about in Africa or something. No, Africa comes to us now with by the vectors. We have not just Colicoid is not just insects, it's also ticks, so tick-borne diseases. They are coming, they are even following the people. So this is really something what you have to monitor very, very closely, because there is, I think, a huge potential with the climate change that we will have a very different set of insects here in Germany.
Thank you. And again, those changes in the ecology highlighting really well how closely our national health is connected, obviously, to health elsewhere. We've got another question in the chat, which I'm keen to put to Christophe Bayer before we close it out. Is Andre from Congo, from the DRC. He's saying, how are you going to integrate already existing global health initiatives to like the IHR, the Global Health Security Agenda and its index, into the Pact for Pandemic Readiness? Thank you.
Thank you for this quite important question. It's important that we don't want to create a new initiative by itself, which is Pact for Pandemic Readiness. The Pact for Pandemic Readiness is more an endeavor to bring together the different stakeholders of the G7, so the different initiatives of the G7, in order to better coordinate what we're doing, to better align, and by doing so as well to create synergies. I know creating synergies is quite often an abstract word, but I'm pretty sure that there's quite a lot of potential. So what is important? It's important that this is not another initiative. It should be more or less an endeavor. It should be an exercise of the G7, bringing together and aligning the work we are doing in the field of pandemic preparedness, pandemic readiness. And for example, as you mentioned, the global health security agenda, as well, very much driven by the US, is one of the very big players driving the pandemic readiness, global pandemic readiness.
Thank you. I think very important to say, not a duplication, but rather a political process, trying to bring those together, right, and to amplify the voice. There are 2 comments in the chat I don't want to lose. There are more comments than questions. One is from the colleague who earlier had mentioned the health literacy, Leopold Reif, saying he's happy to take this forward, and a comment from Axel Kröger to Oliver Morgan saying that TDR has already developed a computer system to assist with early warning response system for climate sensitive disease, so something around the changing vectors. And the connection is made there. Excellent, good. So I think we've had a very lively discussion. I think we've heard a lot around some of the challenges of operationalizing these integrated new approaches to surveillance. I think we've heard about the importance of partnership to take forward the Pact for Pandemic Readiness, around building this over time, a trust architecture, but also I think really nicely about how the different sectors can contribute and are already contributing to it. And I think for me, in a way, I'm heartened by the fact that the 4 different actors coming from 4 different aspects of the field really were echoing very much the same sort of things as important and as the points that they want to take forward. But before I close today's discussion, I just wanted to ask our panelists sort of, what are your takeaways from the discussions? What recommendations for the second half of Germany's G7 presidency do you take away from this discussion? Or which recommendations do you want to make? Now is your sort of last chance for an intervention. I'm going to start off with Fabian Leendertz, please.
Yeah, thanks a lot. Wow. So I think we have to learn to listen again to other disciplines and to people on the ground. And this is something which got perhaps a bit forgotten by scientists, like I am one, I guess, right? So we have to listen and learn from people, and we have to think global. I mean, I heard the comment by someone, I'm not saying the name, saying, oh, we have to make it to push the monkeypox back to Africa. Come on, this is not the way we should be thinking. We have to think global because that's in the interest of everybody. And that's all I want to say. Thanks.
Thank you. And I'm going to go to Karoline Schollmeyer next. What are your takeaways? What are your 2 things to do for recommendations for the second half of the presidency?
Well, I'm sticking locally, so I think zoonotic disease from livestock still causes a majority of human infection today. It's not just the virus that have been transmitted from wildlife to humans. So therefore, we should not focus exclusively on you, but also continue to pay attention to the classical disease, such as tuberculosis, brucellosis, and rabies, because they are just in front of our doors.
Okay, thank you very much. And Oliver, I'll ask you from global perspective, WHO, what are your recommendations? What are your takeaways?
Yeah, I think Germany's done a great job actually with their G7 presidency at providing a clear focus, the collaborative surveillance and the effective rapid response. I think I'd really like to see these themes continue into the next presidency, which will be with Japan and beyond, so that there is an ongoing kind of theme, throughout the different G7 presidencies. And I think there's also a great opportunity for the G7 countries who, by definition, have a lot of resources and also a lot of experience to embrace that collaborative approach themselves and see how working within the G7 countries or amongst themselves, we could perhaps have some really useful insights, particularly around decision making. Each of the G7 countries have launched a really interesting and important initiative in the last 12 months about how to do better decision making. It would be great if we could learn from that.
Good, and I'm gonna go for the last minute to Christophe Bayer if you want to reflect back on what the three previous speakers have said or anything else this afternoon.
Yeah, I just wanted to mention that I think we should all stay on track with confidence while keeping the expectations realistic and of course focusing on concrete outcomes. I just heard that one voice was mentioning in the chat global or One Health is quite an abstract word, and that's correct, and it's up to us that we focus on concrete outcomes. Therefore, I think substantially increasing global pandemic readiness is a long-term task related to what we can expect realistically during the next 1-2 years on the short term. And it's a task I consider which we need to work on for a decade or even for a generation. And to be honest, with the current global situation, there's a substantial risk that we will fall back in the cycle of panic and neglect, which might be even further triggered, while there will be an increased burden on the funding available in the current economic situation on the horizon. Nevertheless, I think I call on all of us, I call on the panelists, I call on the participants in particular, all of us, we are sort of health professionals, health advocates, or health policy makers, and it's our responsibility, our joint responsibility to keep this topic high on the agenda and as well work on concrete improvements and outcomes.
Yeah, thank you very much. I think that's wonderful closing words. We're 1 minute over, so I thank all the panelists for fascinating insights and a lively discussion. I thank the people who participated. Thank you for joining us. Thank you for participating in the chat. I think let's break the cycle of panic and neglect. Let's take some of these really important issues forward, and I really look forward to working together with everyone who's here in the virtual room on the second half of the German G7 presidency, but also on taking forward this task in a generation. So I'm going to say thank you very much and bye-bye from Berlin. Bye-bye.